Now, over on the House side, it looks like it's getting to be about a little bit heavier of a lift. Joining me now is Democratic Congressman Joe Courtney of Connecticut. He's on the House Education and Labor Committee. Joe, good to have you with us tonight. Now, you're getting a lot of blog traffic, my man. You're getting, people be talking about your stuff, all right? Now, is it true that you have decided not to take your health care until the country gets theirs when it comes to equality about what they get in the Congress and what the public should get?
That's right, Ed. Thanks for the invitation this evening. When I ran for Congress in 2006, I made a pledge to the people in my district, which is that I would not expect them to subsidize and pay for my health insurance until we had a system which gave them the same opportunity. One of the things that is so galling to my constituents, and I think millions of Americans, is that we've got people down here in Washington, D.C., who the day they're sworn into office, they get a PIN, they get a voting card, and they get a health plan, and it's paid for by the American taxpayer. Yet some of these same folks are the ones who are saying, well, it's too soon, we got to wait, we can't afford to give the people, the taxpayers who are providing their insurance.
All right, now this CBO report that has come out on the Senate side, everybody's all upset about this, saying we can't get it done. It does not take into account the money that the Treasury would get if we tax the top 2%. But do you think that Democrats are starting to use this as cover so they can back away from any kind of public option?
Well, certainly there's some noise out there, but the ironic thing is what CBO has told us is that actually a public option saves health care reform more money than it costs. I mean, you know this, Ed, that the reason why a public option is so important, aside from a stable choice for people, is that it's run more efficiently and will actually bring down costs for the overall health care reform effort. So that's a bad argument if people are out there making it.
And what do you make of some conservative Democrats who were saying that, well, they're not for the public option because it's connected to Medicare reimbursement rates, and that's just not going to be fair to the private sector, and in fact, it might even run them out of business?
Well, they should certainly surrender their label as fiscal conservatives, because the fact of the matter is that Medicare, as you know, runs a very efficient program, very low overhead, and the plan that we are looking at is Medicare plus 5%. So we're actually not really strictly tied to Medicare under the public option.
And I understand that insurance rates in your state are going up 32%. Did I hear that correctly?
That's right. I mean, if people really want to see what the status quo is, Blue Cross is requesting a 32% rate increase for the individual market, which is, as you know, the worst end of the system. Okay.
Congressman, good to have you with us tonight. I appreciate your time. I commend you for what you're doing. You're an unselfish American. Thank you so much.